Firstly, I'd like to acknowledge those two puti puti in the front, Ngāti Mātua's puti puti, and a big welcome to all of the Māori, both nationally and internationally. So Indigenous ways of working, does it work? I'm looking forward to sharing our findings and our perceptions. First of all, I'd like to acknowledge the queer sitting in the third row here, Monica Stockdale. Now, if it wasn't for Monica Stockdale and Lorna Dial, the Māori providers in this room, we would not have come about. I think we always have to go back to where it all started, and in the early 1990s, Lorna Dial and Monica got a pūtea from John Hannafin to go and encourage Māori to meet the needs of gambling. Now, they were both, I believe, creative, energetic. They went around to all the AOD providers, and that's where it all began. So I think it's very important that we never lose sight of those two wahine toa. What's happened to my slide? And of course, I want to acknowledge all the Māori gambling providers in here. Most of you know my mahi. We've been very, very supportive over all those years. And I know that a lot of you have a bit of, resistance to research, but you've always been really good. And the ones that I want to acknowledge is Ngāti Toa, and of course Ngāti Kahungunu, who came in to actually support both the master's study and the doctoral finding and the postdoc. So kia koe mere and that one I'm sitting over there on the couch. And of course Te Hapai Te Hauora for funding my scholarship. And of course it goes without saying I've got to acknowledge the funders, the Health Research Council, who saw it in their wisdom to make it to fund me to address to look at Māori women and gambling. I know that that's really small writing, but I think it's really important that we look at our history. It started in 1995, then we come to 1997 to 2010. 15 Māori organisations were established in Northland, Auckland, Waikato, New Plymouth, Rotorua, Napier, Gisborne, East Coast, Wellington and Christchurch. Now in 2003, the first workforce capacity report was done. Now that reported that Māori providing services with minimal resources, and I'm sure that all of you in here would remember that. In 2003 we had the development of Te Here no Waka o Te Ora Whānau, and this was an incredibly exciting time when we all got together, we all awhita the kaupapa, but more importantly it gave Māori their rightful place and voice on gambling. 2004, Ministry of Health take over the portfolio. 2009, you know about Te Kākano Public Health Workforce Development with Hāpai. But I want to talk about the very, very first International Indigenous Symposium. Now, we put this together on the smell of an oily rag. We encountered quite a few barriers, but that's okay. We're really good at long jump and high jump. We jumped over every hurdle to make it happen. It was an amazing conference or symposium, and I think that it's about time that we revisited that, but that's for another corridor. Then of course the National Coordination Service with Layla holds now. And I think that was right. Currently there's 12 current provider organisations. I've done that one, and then there was the establishment of the National Māori Provider Network, and I believe that that's still in progress. So what's our research capacity looking like? First one was done in 2005 with Robinson, and one of the researchers is in the room, Kerry Hurawai. Developing services in Ngaitahu, then Naina Wātene and Hurdle, who came in with Whakataumaina, and most of us were part of that. Lorna Dial, Dr Lorna Dial, she did the very first thesis on Māori and the impacts of gambling. Then I come in 1999